Hi everyone, I'm Dr. Alessio Platania and I'm a neuropsychosomatic GP and clinical sexologist based in London. Today I'm talking about sexual issues in neurodivergent people. This is rarely discussed, but sexual difficulties are overrepresented in this population and they can have a major impact on intimacy, relationships, self-esteem and general well-being. I'll cover what sexual dysfunctions are and how they present, how we diagnose them, and what support can help. We consider a sexual dysfunction when your sexual life is not as you would like it to be or how it was in the past. Neurodivergence can shape the way a person experiences desire, arousal, and intimacy, so their sexual experience may be different from what is usually shown in mainstream media due to the different sensory profile, executive functions, communication, and relational styles, and also the higher presence of trauma and other medical conditions like hypermobility. Symptoms can fall within four main categories: having pain during penetration, change in desire, difficulties with orgasm, or with erection, and each one can affect the others. In ADHD, people may notice difficulty staying present during intimacy, fluctuation in desire, impulsive sexual behavior, or problem with the emotional dysregulation that affects their relationships. In autism, sensory sensitivity, difficulty reading unspoken social cues, or discomfort with certain kind of touch can play a big role in their intimacy. Some people also experience a mismatch between their internal experience and the expectation from society or their partners, and this can create pressure and distress in the relationship. For the diagnosis, the assessment starts with a detailed conversation, which will explore the person's neurotype, the relationship, the sensory profile, their medical history, and the current symptoms. Hormonal changes, chronic inflammation, and several medical conditions can affect sexual function, so often a general examination and also some further investigation can be needed. It is also important to evaluate the presence of hypermobility, as this is more commonly recognized in neurodivergent people, and it can have a huge impact on sexual function by making people more prone to injuries during sex, vaginal or anal tears, or pelvic floor dysfunctions. The aim is to understand how much sensory, relational, psychological, and physical factors contribute each to the issue. The treatment is very individualized and depends on the root cause. It may include education to expand the idea of sexuality beyond mainstream media, giving new tools to understand themselves, body-based mindfulness practices to reconnect with emotions in the body, and I always integrate somatic psychosexual therapy adapted to the person's neurodivergence needs. For people with ADHD, it may include work on emotional regulation, shame, attention, and the effect of impulsivity or distractibility in their intimacy. For autistic patients, this may involve clearer communication, sensory adjustments, and support around boundaries. Of course, when needed, medication, specific supplements, or further medical or surgical management can also be very useful. The most important thing to know is that everyone deserves pleasure, and neurodivergent sexual issues and concerns are real, valid, and treatable. The goal is not to make someone fit a standard template, but to help them achieve intimacy in a way that works for them. Thank you for watching.